Welcome to Mayo Medical Laboratory's Hot Topics. These presentations provide short discussion of current topics and may be helpful to you in your practice. Our speaker for this program is Dr. Glenn Roberts, a professor of laboratory medicine and pathology and microbiology, as well as a consultant in the Division of Clinical Microbiology at Mayo Clinic in Rochester, Minnesota. Dr. Roberts provides a four-part introduction to clinical mycology, including culture and identification of organisms encountered in the clinical practice. This is part 2 in the series. Thank you, Dr. Roberts.
Thank you, Sharon, for that introduction. I have nothing to disclose. The introduction to clinical mycology. This is the second in a series of 4 presentations on clinical mycology. Part 1 was the diagnosis, classification, and general features. Part 2 reviews the basic structures of molds and yeast, presents a brief introduction to the direct microscopic examination of clinical specimens, and also discusses media that are useful for culture. We will cover these today. This is a list of general terms used in clinical mycology, and the thing that I think most people have trouble with is the language that we use. It's not that the discipline is so difficult to understand, it's the terminology that we use to try to define what we're looking at. Well, these terms here give you examples of things that we use on an everyday basis, and we'll just go through these and you'll see them enough times that I think they'll become clear as we go along. Hyphae. These are 2 black structures that compose a mold colony. If you think of hyphae as being long garden hose that transports media and nutrients to the body of the fungus, that's what a hyphal strand is. And we call them hyphae is plural, hypha is singular, and we call them hyphal strands. We know that in some cases the hyphae are divided up into compartments by cross walls, which we call septate. And this allows the organism to survive. If these pieces break apart, each one of those can become a separate organism. There are hyphae that lack septations, and we call these non-septate hyphae. There are hyphae that lack pigment, that are just simply clear and stained with the dyes that we use to examine them with, and they're called hyaline hyphae. Some of the hyphae are pigmented by a dark pigment, whether it's brown, dark gray, or black, and these are called demediaceous hyphae. There are structures within the fungal hyphae and at the end of a hyphal strand that are nothing more than overwintering structures. They're round structures, and they're called Cryptococcus. And then we see commonly the asexual spores produced by the molds that have septations in their hyphae, and these spores are called conidia. This is an example of what we call the universal fungus. It shows many of the different kinds of spores that are seen, as well as some other structures. If you notice, down at the bottom of this illustration is called vegetative mycelium. Mycelium is a collective term for hyphae that are grouped together, like that make up a colony, total colony. It's an old term that's not used very often, but these are hyphae that can form a number of structures. If you look at on the bottom right hand side, you'll see what's called Arthroconidia. On the right side, you'll see the term. This is a hyphal strand that is broken down into compartments by the production of septations. This is the simplest mode of reproduction of the fungi. On the very bottom right-hand side, the term chlamydospore can also be called Cryptoconidium. This is what we talked about a minute ago. These are overwintering type spores that form in the inside of a hyphal strand or at the terminal end of one. If you notice on that same strand by the Cryptoconidium, you'll see some very small spores coming off the side. Those are called Microconidia, if there are 2 kinds there. And on the far left-hand side, you'll see one that has a green color that's called Macroconidia. These are 2 extreme examples. One is a large spore, one's a small spore. Macroconidia, Microconidia. And we use all sorts of terms. We use for the Zygomycetes, we use the Sporangium, that is the structure that produces the spores. If you notice the one that looks like the fingers on a hand that is branched, that is Penicillium. You notice that the spores are produced in chains at the tip of elaborate structures. Spores are produced in a number of different ways. The morphology of the fungus depends upon the arrangement of the spores and how they're produced, and we'll look at some of that as we go along here. Well, Cryptoconidia and Arthroconidia may be present in almost any of the molds. Some of the fungi that we deal with reproduce in an asexual way and also a sexual way. The results of some of the sexual reproduction among some of the classes of the fungi result in some spores called Ascospores that we see not very frequently. Some of the fungi that we deal with are dimorphic. They have a mold form in nature or in the culture, and they have a yeast form in the patient or at 35 to 37 degrees centigrade. Most of the colonies of molds are fluffy or fuzzy. They are filamentous organisms that are made up of hyphae, and when you look at them microscopically, you notice that they do look like fuzzy colonies, and for example, some of the laboratories just simply call them fuzzies because of that. This happens to be an illustration of a Cryptococcus. It's probably the world's largest Cryptococcus that you've ever seen, but it's nothing more than a round spore that's sitting internally in the side of the hyphae or at the end of one. This is an example of hyphae with Arthroconidia. On the lower left-hand side, about 7 o'clock, you'll notice that the hyphae are beginning to break down into spores that are kind of rectangular, almost rounded ends on them. Those are Arthroconidia. And that is the simplest mode, again, of reproduction for the fungi. Each one of those will break apart and can germinate and form an entirely different organism. So we see Arthroconidia forming with almost any of the fungi. They're not specific for any particular organism, at least in this format. Here's what it would look like underneath the microscope. If you had a stain preparation, you would see that these are breaking apart. They're rectangular in shape, and each one of those, again, is a separate unit. With the Zygomycetes, we define them as having polyseptate hyphae. Polyseptate means there are a few septations, or can be a few septations, but for the most part the hyphae do not have septations within them. The Zygomycetes produce sporangia, the sac-like structures that are produced at the end of a long stalk. The sporangia produce the spores. Hallmark of the Zygomycetes is the growth rate, very rapid growth. They may have root-like structures called rhizoids that anchor them to the substrate surface. They may not, and if they do have them, the arrangement of those rhizoids helps with the identification. This is an example of non-septate hyphae. These hyphae are large. They transport nutrients through the body of the fungus, but there are no septations, and so if one of these hyphae happens to break apart, all the nutrients will leak out. The cytoplasm leaks out because that whole entire hyphal strand will become non-viable. And this brings up a point about culturing, which is not discussed at this point, but I'll just tell you anyway, and that is that if a patient happens to have an infection that you suspect is caused by a Zygomycete, you need to let the laboratory know about that, because in some laboratories the tissue is ground up and processed in that manner before it's cultured. If it happens to contain a Zygomycete, all those hyphae will be destroyed, the cytoplasm will leak out, and everything will be rendered non-viable, and you'll never recover the organism. So that if you suspect that a Zygomycete is there, the clinician tells you that, you can then cut up some small pieces of tissue or whatever it happens to be and culture those, and hopefully we'll get a viable segment of an organism in there that will grow so you can identify the organism. This is what the hyphae look like underneath the microscope that are non-septate. You can see no septations in those at all. This is an example of polyseptate hyphae. There are a few septations in there, not more than about 3 or so. And with hyphae that produce regular septations, you would see them much more frequent than you see them produced here. So this is an example of what we call polyseptate hyphae. This is a sporangium of a Zygomycete that shows you a big sac-like structure. On the outside you see what looks like the wall has been removed, and you see the spores that are there. And at the very base of that, you see where the sporangiophore is then attached to that sporangium. And that whole big structure there will rupture. All those spores will pour out into the environment, and each one of those is capable of starting a new colony. So that's a sporangium of a Zygomycete. The Ascospores are a group of fungi that have septate hyphae. As a result of sexual reproduction, they produce ascospores that are unique to that particular group. Most of the fungi within that group produce asexual spores called conidia that we use to identify the organisms. This is an example here of what sexual reproduction would result in, or production of ascospores. The ascospores are produced inside of a sac called an ascus, and usually there are 8 ascospores inside of an ascus. Another name for ascus is ascocarp. It just means a structure that produces ascospores. So this is what they would look like. Sometimes, though, those are produced in long tubular type arrangements. Sometimes they're in a sac-like arrangement like you see here. This is a good example of what one of the Ascomycetes might look like. There are lots of them. If If you ever had an orange or a lemon in your refrigerator that's been there too long, you notice that it's starting to mold. Generally, that's caused by something like penicillium. That is one of the organisms that belong to the Ascomycetes. And as you know, penicillin is produced by penicillium and by a particular species of penicillium. Mold on this orange, you can see that it's a green kind of a mold, and it is penicillium. If you look underneath the microscope on the right-hand side, you'll see it has some pretty elaborate looking structures, and at the very tip of what look like a little bottle-like structure are the conidia. Those are the asexual spores that are produced by penicillium, and those are a result of asexual reproduction. Well, another group of fungi that we deal with is called the Basidiomycetes. They produce septate hyphae, but they include the mushrooms, the smuts like corn smut, wheat rust, and some others. They produce spores called basidiospores when the organism reproduces sexually, and this happens with the mushrooms. They produce conidia in the asexual form. This is an illustration showing you a mushroom on the right-hand side, and if you look under the underside of the cap of that mushroom, you notice that it's made up of gills. On either side of a gill are these structures called basidia, and they produce the basidiospores. Basidiospores are produced on little denticles off of the basidia. They hang down, and then those are spread around by the wind or whatever happens as the mushroom cap begins to dry. The basidiospores are not something that you would see in the laboratory at all. Something that is interesting, though, is that we have one pathogen that we deal with that belongs to the group Basidiomycetes. That is Cryptococcus neoformans. And the rule in mycology is that if you find the sexual form of an organism, you give it one name, and you give the asexual form another name. Well, the asexual form of this organism is Cryptococcus neoformans. The sexual form is called Phylobasidiella neoformans. And this is a very common human pathogen. The problem with this nomenclature is that when you try to change the name of an organism whose name has been around for 25 to 50 years or longer, it's not accepted very well to change that name by people who do the work. And so 9 times out of 10, you rarely hear the term Phylobasidiella neoformans, even though it is botanically correct. So this is an example of something that belongs to the Basidiomycetes. We have another group of fungi that we deal with in the clinical laboratory, and these are the yeasts. The yeasts primarily are made up of budding cells called blastoconidia. Blasto means bud, and conidia means spore. Some of these yeasts produce pseudohyphae and true hyphae. We know true hyphae are these filaments that look like garden hoses. Pseudohyphae are nothing more than yeast cells that have elongated and remained attached to each other, and they look almost like a hyphal strand, except that where the yeast have elongated, the ends are rounded, and you'll notice that it's not one big long filament. It is made up of a number of elongated cells that have rounded ends that are still attached to each other. They look like links of sausages. Ascospores are produced by some of the yeast, and you can use special stains like the acid-fast stain to be able to show those if you need to do that. Most of the yeast produce creamy bacterial-like colonies. If you grow yeast in the laboratory, you notice it will smell almost like a bakery. The yeast are very important in agriculture, and very important in the baking and brewing industry, but they're also very important in the clinical setting because they do cause human disease and lots of problems for immunocompromised patients. Some of the fungi are dimorphic in that they produce yeast in the tissue or at 35 to 37 degrees centigrade in the laboratory under the right conditions that you would have to supply. This is an example here of a yeast underneath a scanning electron microscope showing you some of the structures that are labeled. The cell that says YMC is a yeast mother cell. That is the primary cell. On the left of that, you'll see what looks like it's called a pseudohyphae. It's starting to form one. It's elongated and it's narrowed down where it attaches to the yeast mother cell. On the cell above it, you'll see a round cell on the right-hand side that says GT. That's a germ tube. And that differs from a pseudohyphal strand in that it's not narrowed down. It just comes straight out of the yeast cell. And we use a germ as a means of trying to identify Candida albicans. If you look on the left-hand side, you'll see there's the elongated cell, a hyphal strand. It's a hypha. So you see these structures with yeast, and as we go along, maybe you'll see some of these. This is an example of how the yeast reproduce. They reproduce by buds, by blastoconidia, and the small cell on the right coming off of the mother cell is the Blastoconidium. Just another example of budding yeast cells. You can see the small bud coming off a number of those cells. So yeast reproduce by budding. These are yeast colonies. This happens to be Candida albicans. It's bright white, but you cannot identify a yeast based on their colony morphology or the color. You still have to do it other ways, which is morphologically and biochemically, to put a name on these specifically. But these are small colonies. They're bacterial-like. They're not mold-like colonies at all. Example of what we talked about a minute ago, the pH shows you pseudohyphae. You see those elongated yeast cells that have the narrowed ends, look like links of sausages attached together. And on the right-hand side, you see a Blastoconidia, or a yeast cell, big cell at the bottom with a bud at the top, right at the tip of the arrow. That is a budding yeast cell, Blastoconidium. So this is what you might see, a combination of those yeast cells and pseudohyphae. Anytime you see a combination of budding yeast cells, hyphae, or pseudohyphae, you know you're dealing with something that belongs to the genus Candida, because that is a characteristic of that particular genus. There are times when you see yeast cells that produce by buds and also may produce Arthroconidia. Now, in a case like this, you'd have to discern which is the predominant form that you see. This is an example of an image that shows Arthroconidia in yeast cells, and there are some yeasts that produce both of these. Predominantly, you'll see budding yeast cells, or you may see some that predominate with Arthroconidia and a very few number of Blastoconidia or budding yeast cells. In terms of being able to detect fungi in clinical specimens, we do have methods for detecting these organisms in clinical samples. The KOH, or potassium hydroxide preparation, is probably the time-honored procedure that's been used for so many years. Still works. It's old, but it still works. We added a compound called calcium white, which is a fluorescent brightener, to that, and it allows us to be able to use a fluorescent microscope and increase the sensitivity and be able to see the morphology better of some of the organisms that are found in clinical specimens. The PAS stain, the periodic shift stain, has been used for many years. It's not used so much now in clinical laboratories. It's a tissue stain, but it still works. The Gram stain is used for staining bacteria, as you probably know, but it also stains fungi. And so when you're looking at some of these stains that are not specific for fungi, you need to think microbiology a little bit, because you're apt to find some of these things in stains that don't normally stain the things you're looking for. For example, the Gram stain stains bacteria well, but it also stains fungi. And you need to be conscious of the fact that you can see other things with some of these stains other than what you're just looking for. The right stain is used in hematology. You can see some of the fungi stain in blood films or on bone marrow cells. You can also see it in a cytospin preparation of a spinal fluid looking for cell count. Calcium white is used, as I mentioned, as a fluorescent brightener. It's a non-specific stain that binds with a chitin in the cell wall of the fungi. And you have to use certain filter combinations, 440 nanometer filters. They're very costly, but they work well. And the calcium white needs to be made up ahead of time and kept in a bottle that is dark, it is covered with foil because it's light labile. But it's a very useful tool in the clinical laboratory to be able to look at the fungi. This is an example here of calcium white. You can see that this organism with a filter combination appears to be blue-white. And there are septations at where the tip of the arrow. So this would be an example of septate hyphae in a clinical specimen. Now, in a non-sterile site, it may or may not mean anything. But if it's from a sterile site, then you certainly will be able to report that, and about all you will be able to say is you see septate hyphae in a specimen, because many organisms can look like this. In terms of the type of microscopy that can be used to examine the clinical specimens, bright field microscopy can be used with things like the Gram stain and so on. It can be used also if you turn the light down or you close the iris diaphragm down, you can get some contrast. You can see organisms in clinical specimens. Phase contrast microscopy is not used so often anymore, but it does a nice job of being able to allow you to see fungal structures. The armine rhodamine stain is used in the mycobacteriology laboratory and can stain organisms like Blastomyces. The Ziehl-Neelsen or the Kenyon stain is an acid-fast stain that uses methylene blue as a counter stain. And the organisms may not necessarily stain acid-fast, but you can see them with a counterstain. So you have to look beyond the acid-fast part of the stain. The Papanicola stain is used in cytology for looking for cancer cells. You can see fungi in pap smears of sputum and other clinical specimens. And then in the clinical laboratory where the pathology is involved, you notice that the Gomorrhean methenamine silver, the H&E, the PAS stain, all those stains there. Some of them are used to detect tissue morphology, others are used to detect fungi. But when you're looking at a section, you have to be thinking about anything, and the fungi are one of the things that the pathologist has to be looking for. And the microbiology laboratory can be of some help in recognizing some of those fungal elements. In terms of trying to make a definitive diagnosis of an organism, first you have to be able to culture it and grow it up before you can make an identification. Then you're faced with which media do you use for trying to grow these organisms. There are a number of media available that have been around for many years, a few new ones. Brain-heart infusion agar has been around for a long time, works fine for recovery of fungi. Sabrose dextrose agar is one that's been written about in textbooks for many, many years, and is probably the worst medium for growing fungi that we have. It is a good subculture medium, but it's a poor primary recovery medium. Inhibitory mold agar is an agar that is very useful for the recovery, and it does not inhibit molds like it sounds like it might. It has chloramphenicol in it that inhibits bacteria and allows the molds to grow. Hyphae agar is a combination of sabrose and brain-heart infusion agar. It works well. Mycocell is sabrose agar that contains chloramphenicol and a compound called cyclohexamide. Works fine for recovering dermatophytes, but primarily not much of anything else. Potato flakes agar is developed in recent years at the University of Texas in San Antonio. Works fine for primary recovery. Yeast extract phosphate agar will be shown as an example a little later on how to recover some of the organisms from contaminated clinical specimens. This is an example of something that is important for you to remember in the clinical laboratory. Not only are you faced with which media do I use for recovery of things, but once you decide which ones you're going to use, you must become familiar with the morphology of the organisms on those particular media, because they can look different depending on the medium. And this is the same specimen, same amount inoculated onto 3 different plates of media, all containing different ingredients. The upper left is sabrose dextrose agar. This happens to be Cryptococcus neoformans on sabrose agar where it's white. The upper right-hand side is inhibitory mold agar. The colonies are kind of golden. And the bottom single plate is brain-heart infusion agar that contains blood enrichment. And notice the colonies are more compact and a little bit off-white. So that's pretty consistent for those media. You need to not only know which media to use, but know what they look like on those media to help you with identification. This completes the Introduction to Clinical Mycology Part 2. The Introduction to Clinical Mycology and future presentations for Part 3 presents specific information on the culturing and incubation of cultures for the optimal recovery of fungi, and Part 4 presents methods for identification of fungi, primarily the molds, and some helpful hints for working in the laboratory.